reflect on global health ethics and the challenges before us. It was a year ago on this date that the World Health Organization declared a global pandemic. It's been a year of loss, of uncertainty, and of disruption. It's also been a year that revealed the extent to which we are interconnected and interdependent in a global human community. Our hope for a better future is fragile, and yet it is this hope that can and must propel us forward. The gift of this new book is its encouragement to us all to keep pressing on and to redouble our efforts together in solidarity to realize the possibility of global justice, not just now, but for future generations. The format of today's virtual book launch will be a keynote address by Dr. Eric Meslin, followed by remarks from Professor Ross Upshur, Professor Angela Mashford-Pringle, and Professor Isabella Bakker, after which we will leave ample time for Q&A with the keynote speaker and the panelists. Our gathering will then conclude with closing remarks by Professor Solly Benatar. Before I introduce Dr. Meslin, I have a few housekeeping notes to run through. During the Q&A portion of today's gathering, we will try to address as many questions as possible. You can direct any questions you'd like to have answered by the keynote speaker or panelists using the Q&A function on your screen. For those interested in purchasing the book, a link will be shared in the chat box. If you have any questions after this webinar, please send them to globalhealth.dlsph@utoronto.ca, and this email address is also being shared in the chat box for your use. With that, it is my pleasure to introduce Dr. Eric Meslin. Dr. Meslin is President and CEO of the Council of Canadian Academies. He's adjunct professor at the Dalla School of Public Health at the University of Toronto, senior fellow at the PhD Foundation of the University of Cambridge, and 2020 to 23 mentor for the Pierre Elliott Trudeau Foundation. Dr. Meslin has published more than 200 articles and book chapters on bioethics aspects of genomics, international health, big data, and research with human participants. He's been a member of advisory committees to the World Health Organization, UNESCO, the Canadian Institutes of Health Research, the Institute of Medicine, the UK Biobank, the CDC, and Genome Canada. Thank you, Eric, for joining us. We look forward to your address.
Thank you, Jen, for the very kind introduction, and thanks to the Joint Center for Bioethics and the Center for Global Health for the invitation to launch this book, though I think in today's parlance, we're supposed to refer to it as a book being dropped. I think that's the phrase that one now uses. I don't want to dwell on bio-sketches or intros, but I can't resist expressing the sources of my thanks that comes with the honor of participating today, namely my own longstanding association with the JCB. In fact, I'm old enough to remember the early days when it was just called the Center for Bioethics, occupying a lovely church on College Street in Toronto. And my equally long-standing friendship with Ross, with you, Jen, and with Solly. It's a privilege to be asked to help with such an auspicious occasion. Book launches, of course, are delicate little matters of scholarly activity. They're sort of a recipe with many different parts. They're one part celebration, one part advertisement, a kind of presentation of scientific results, a bit of a book review, a quasi-festschrift for the authors, and then some original remarks. So it's a fairly daunting task to do all of that in about 30 minutes, and I'll do my best. It's especially daunting when one of the authors, in this case, one of the editors, Dr. Benatar, is online and watching. So greetings, Solly, and I hope I do you proud. What's not daunting, however, is to begin with congratulations to Solly and Gillian and the 64 other contributors for delivering to the world their second edition of this book. I'm one of the few people that might have received an advance copy, so I should begin with a bit of a disclaimer. I didn't manage to read all 500 pages of the book. You should know that in advance. This is not going to be a book review. There'll be times for that in the future for others. I took a bit of a cafeteria approach. I hunted and pecked, and I tasted, and I dabbled, I skimmed, I read a number of chapters, and I got essentially a taste for the entire meal without consuming every single part. For this reason, as you'll see, I've chosen to steer a somewhat wide berth around any individual part, selecting a few items I want to highlight and hoping to leave as much room for my colleagues on the panel to weigh in as they wish. One final preambular point before I dive in. As Jen noted, anniversaries are often mixed bags. Sometimes they're celebrations. We're celebrating the birth or the launch of this book, while at the same time recognizing an ongoing tragedy that has befallen our planet in the form of the pandemic. The world has experienced 118 million cases and more than 2.6 million deaths, not to mention significant economic and social disruption that will be felt for decades, even after the spectacular science-led vaccine development has been presented to us. March 11th is also conspicuous for another anniversary. It was 10 years ago today that the Fukushima nuclear disaster occurred following the tsunami in Japan, an event that only resulted in one official death by radiation, but an event that continues to offer lessons about preparedness, response, and the long-term impacts of technology on the public's health. So, with those of my own housekeeping items out of the way, let me begin. I'd like to divide my remarks into what I call 4 observations. The first is that global health is a maturing field in its own right, and global health ethics a sub-discipline developing all on its own. But there continue to be echoes, very powerful echoes, of ongoing and earlier discussions from related discussions in international research ethics. My own initial awakening to international research ethics, and I would say that of bioethics, began as a graduate student almost 4 decades ago when I was first introduced to the WHO's definition of health, unchanged since 1948, as being, quote, a state of complete physical, mental, and social well-being and not merely the absence of disease or infirmity. This wasn't a precursor to a robust discussion of global health, however, mind you, but rather as an entry point, for me anyway, to discussions in the philosophy of medicine about the concept of health and disease generally as applied locally. Indeed, the idea of global health and global health ethics was, for me at that time, limited to the penetrating debates about the quality of healthcare in Canada as compared to the United States, and the moral superiority that we claimed in Canada over our colleagues in the US. I vividly remember a paper with my colleague Nancy Jecker comparing the moral status of Canada's origins from the perspective of justice theory, and judged Canada to be morally superior to the US with respect to the way it delivered healthcare. How charming that discussion was in 1994, how non-global that discussion was, and yet we thought by looking across the 49th parallel, we were cutting new cloth. This may be why I appreciated the chapter by David Hunter and Angus Dawson, which is chapter 6 in the book, that asks whether there is a need for global health ethics. And the answer is yes and no. I will refer you to the chapter to learn why they came to a fascinating reciprocal dialogue about what global health ethics is, what it should be. A more pivotal appreciation for me, and I would say for bioethics generally, rode in on the horse of international research and a cluster of topics and concerns that globalize the already deep analysis of ethical issues in research involving human participants that had been underway since the late 1960s and early 1970s. Some of these issues were highlighted by the following examples. The issues around the design and conduct of clinical research, such as the ACTG-076 HIV serotransmission studies in the late 1990s, which stirred considerable attention to the inadequacies of prevailing research ethics paradigms at that time, leading to intense discussion and debate in scholarly circles, in political circles, and in regulatory environments, and a non-trivial number of committees and commissions trying to understand those issues even better. The funding of research, which included the example from the Global Forum on Research's decades-old phrase, the 1090 gap, referring to the minimal amount of funding being spent on diseases that were affecting a massive proportion of the planet, was an indication of the first evolution from the narrow focus on individuals, which was the dominant paradigm in the research ethics world of the 1970s and 80s, to an emerging paradigm focusing on communities and populations. The accelerant effect of the Human Genome Project added further nuance to the intersection of research and health in a global environment in several ways. The research paradigm changed from research on human beings to research on pieces of them, such as DNA, and then to populations. These include deeper appreciations of the concepts of risk and harm, including the idea of harms as setbacks to interests. The risks of deploying new technologies with unequal benefit to the global north as contrasted to the global south was not first described by those working in genetics and ethics, but was certainly highlighted in those early days. The use, deployment, and commercialization of research knowledge as evidenced by developments in the intellectual property world, and the many examples from biobank studies that showed how countries recognized a commercial value in their own genomes that gave rise to new forms of international trade and collaboration issues. And at the same time, the moral, epistemic, and regulatory architecture that was deployed for anticipating ethical, legal, and social issues in research started to become normalized across the planet. The US Belmont Report and the Common Rule and the US IRB system, regarded by a former HEW secretary as one of the United States' most excellent exports ever, showed how this new development in scholarship and regulatory work was slowly penetrating a global environment, including much of the early literature celebrated, of course, by Beecham and Childress's principles of biomedical ethics and their derivative principle-based approaches. I vividly remember, as I'm sure Solly does, a visit that I made to Cape Town in 2000 as part of a PABIN meeting and giving a lecture, a grand rounds, I believe, at the University of Cape Town on July the 24th, and was asked by someone in the very back row of that lecture theater what I thought of the revisions to the current Beecham and Childress text compared to the previous two versions. I was, as we say, gobsmacked to have gone to Cape Town to find someone asking me whether volume 4 of Beecham and Childress was substantively different from volume 2. Helsinki SIAMs and the more than 1,000 guidelines from more than 130 countries collected in the OHRP's annual compendium attest to a version of harmonization huddled around central topics of informed consent and prior ethics review and approval by duly authorized committees as further evidence of that kind of globalization of a research ethic that we probably didn't fully appreciate until later. And then, of course, early experiments in both regulatory and ethics language around novel ideas at the time, such as prior agreements, responsiveness to local need, reciprocity, benefit sharing, and equivalent protection. Now very common phrases and terms that we debate and extract new meaning from. But in the late 1990s, these were disruptive concepts in a global environment. So as for observation number 1, global health ethics is a maturing field in its own right, but there continue to be echoes of those earlier discussions from international research ethics, which we should continue to pay attention to. Here, I might recommend chapter 34 by Tiki Pang and Gianna Amul for their helpful description of the future research agenda for global health as evidence of this new development. The second observation is that the value of horizontal integration of these issues is certainly worth benefiting. And my observation that the field has matured gives rise to this second or related one, namely that there are notable factors that help explain how the maturing of global health and global health ethics has been reflected in this collection by Solly and Gillian. For example, the need for growth and development of humanitarian responses arising from natural disasters and even human-caused events, including war, has been both a regrettable reality and a virtuous development in the field of global health. This is why section 3 of this book is among the most impressive. It speaks to what a humanitarian ethic is, what it looks like, and how it might be deployed in discussions when historically humanitarian intervention was seen as much as a benevolent act by well-meaning charitable organizations and has now become an intensive medico-political foreign affairs tactic. There is much to be learned by those developments. Secondly, and there are 6 of these little dot points in observation number 2, if you're keeping track, the broadening of the funding tent beyond the former dichotomous government-private sector pairing for science and technology, research and development, has now included philanthropic organizations. It is hard to remember that there was a time when we relied only on a very simple pipeline. Federal governments fund basic research in universities, private companies fund research that commercializes or applies that work, and that's how the world is divided. By 2000, the funding of clinical trials had been substantially overtaken by the private sector as opposed to governments around the world. But meanwhile, philanthropies and charities really took a major and played a major role in research and in health development. Here again, it was heartening to read James Wilson's chapter 33 on philanthrocapitalism and global health. It reminded me of the Economist's front page cover many years ago when it discussed in some depth what Bill Gates and Warren Buffett knew that no one else did when they were investing their money rather than simply giving it to good causes. This is a sea change in thinking about the power of funding, what I would call the new golden rule, not the one that you learned about in religious schools, but rather whoever has the gold makes the rules. That is the new golden rule that we're learning from that funding tent expansion. We're also learning, and this is why I'm referring to it as a horizontal interrogation, that the economic fragility illustrated by both the financial and health pandemics most recently, but including the economic collapse of 2008, reveal to us just how needful we are of a model of resilience, rebound, and recovery. It's become quite fashionable to use multiple R's, whether it's resetting, rebuilding, reimagining. I think there's a charming alliterative model in policy development that speaks to this. But quite frankly, if we don't pay attention to what the causes of the fragility were that led to the need for more resilience, rebuilding, or building back better, we will face yet again, and I'm sure Dr. Upshur will have hours to lecture us correctly on about the lessons that we have failed to learn from the past epidemics and pandemics. We have as much to learn from past epidemics of financial mismanagement as we have about various viruses. Demographic changes have also been I think, underappreciated factor in how the global health and global health ethic conversation has occurred. Not only are there uneven impacts on society and populations, there are micro impacts that are being only now appreciated with respect to the age of individuals, the growth patterns in different countries, and what countries will look like 5, 10, 15, and 20 years from now. Preparing for my 90th birthday, which I have more than a 60% chance of achieving based on my genome and my lifestyle, is a very different future than even my 27-year-old daughters, who have a 60% chance of living to 100, to say nothing of those who live in the global south, whose age ranges and life expectancies are also increasing, but at a slower rate. A final note about this horizontal interrogation relates to climate, and I'm just going to do a spoiler alert. My last and final observation is going to pick climate and the environment as just one case study that I will focus on. So the topic list and the chapter headings in this book refreshingly weave together areas that had not come up, or if so, only rarely, in discussions of ethical issues in health or global health research in decades gone by. But liberated from the research ethics paradigm and its contractual regulatory frame, this new approach permits a much wider discussion, not only of the social determinants of health, but the geopolitical, economic, and even national security issues that we're facing. Taken together, these and other topics have had the following unintended consequences. First, they have illustrated an interdependence and interconnectedness among these issues. Second, they have opened the doors of dialogue much wider between civil society and elected governments. Some of those doors have been opened voluntarily, some have been knocked on, some have been pushed through, but nonetheless, we will not return to a time when simple top-down decision-making is the order of the day. It has also challenged what I would call the files by silos model of Westminster governments. That model, of course, is that health issues are handled by ministers of health, labor issues are handled by ministers of labor, climate issues are handled by ministers of the environment, etc. No longer is that even possible, as both the financial crisis and the pandemic have illustrated. The phrase all of government or one government or whole of government is starting to mirror in some very, very minor ways, which Ross and his colleagues picked up in their chapter 17, the idea of one health, a fascinating concept as applied to global health, but we're also seeing echoes of it in governance, something again I'll refer to in a moment. So that's observation number 2. The third observation, despite different topics, global health continues to highlight common themes familiar to interdisciplinary and transdisciplinary scholarship. An underappreciated challenge for tackling big and sometimes wicked problems is how best to deploy the intellectual and practical resources necessary to understand them and to take action. For those raised in the analytic tradition in philosophy or applied ethics, there are accepted pathways for engaging these discussions, oftentimes beginning with conceptual analysis, moving inductively or deductively, and having particular epistemic frames for understanding what those problems are. In fact, sadly, we're all very good at being what I would call house inspectors in this domain. We're good at problematizing better than anyone and defining what the problems are. We're not always so great, like our engineering colleagues are, at solving for them. That's why the practitioners in these discussions, the clinicians, the public health officials, even the public policy experts, play a central and, I would suggest, underappreciated role in the translation of that evidence into policy. Global health shares with other widely distributed files this interdisciplinary and transdisciplinary need. And yet what I feel we have observed and are only recently sort of cracking the cover on, no pun intended, with books like the one we're celebrating today, a set of common, familiar, practically ancient topics that we're still trying to get our heads around. Here's a short list of them. Justice and injustice. This topic figures prominently throughout this book in its distributive, compensatory, and structural forms. More than any other topic, the place and role of justice as fairness, as equity, and of the moral obligations we might owe to others strikes me as one of the most compelling narratives and ethical challenges we face in global health. It is most evident in the several obviously titled chapters and in the 32 separate index entries in this book, befitting of one of the biggest tents in bioethics. It includes everything from the availability of scarce resources to the care and treatment of individuals and communities. As those of us who work at the intersection of ethics and policy, or evidence and care, can attest, just naming the problem is hard enough. Figuring out how to move from positions of inequity to ones of fairness in a global environment under the stresses that I've referred to earlier remains what I would consider an existential challenge for all of us. A second and obvious theme familiar to interdisciplinary and transdisciplinary scholarship is the recognition of and response to the impact on vulnerable persons and communities. Even that language has been challenged in the past several decades. Using the word vulnerable itself is now a term of some concern, whether appropriate or not. But I can tell you that in the early days of the research ethics paradigm I referred to earlier, the name of a recognized moral category called vulnerable persons was littered throughout guidelines, regulations, and policies as a positive statement of recognition of those who were in need of help, could not speak on their own behalf, and would benefit from those recognizing the respect due to those difficulties. We have seen a sea change in thinking, which I would suggest has been not only valuable but welcomed, because we can also recall that women were included in the early categories of vulnerable persons who were in need of additional protection in areas such as research. So the idea that gender is a category of vulnerability would strike some as bizarre today, and yet only 3 decades ago, it was not. How do we see this transforming into discussions today? Some of us were having an offline discussion before this session even started about the COVID vaccines and the effect or possible side effects that are now being reported in women as opposed to men. So the topic and place of gender is found in this book, and will, I could suggest, be a topic not only worthy of ongoing discussion for those who hold up half the sky, but will be a discussion for those who are trying to figure out how best to craft a solution to these ethical challenges. Another sort of topic that highlights these common themes that we have been addressing for years has been the role of expertise and the value of expertise to governments. The idea that having an expert commission or a group of experts to advise the government has been a very common practice. In fact, the very first Royal Society was chartered by King Charles II in 1662. So we've had expert advisory groups and academies for quite some time. I run an organization called the Council of Canadian Academies, which prides itself in being able to attract the best minds and the greatest experts to come onto panels and provide information. And yet what I think the global health ethics challenge that Solly and Gillian and their collaborators have presented to us is that there are many forms of expertise, many ways of knowing, many forms of knowledge and providers of that knowledge that we have only recently begun to appreciate. So the idea that the government asks for advice and a group of experts, either self-appointed or selected, provides that is a very narrow opportunity for what I think should be a much broader conversation. And lastly, in this third and second to last observation, a theme that I think has occupied our attention for many years, and that is the use of what I would call paradigms and paradigm cases, a very common heuristic strategy in teaching and a very useful technique in policy development. How is this case that we're dealing with today like or unlike a similar case before? It's a very useful thought experiment when done properly. So asking ourselves, what is global health more like or less like? I've already suggested it is both more like research ethics and less like it in some ways. It is more like some areas of horizontal governing where the topics are not limited to health buckets or science buckets. So the challenge of how we select which paradigm we're using is what I might refer to as a translational paradigm in need of a further conversation. It suggests in this book, and I could point to probably a half a dozen chapters, that there are many ways to cross the so-called valley of death from evidence to implementation. The book is littered, particularly section 1, on all the evidence you need. You don't even need more than what's in this book to know what the problem in global health. You can find more if you want it, but you have all that you need, all the evidence you need to know that there's a problem that needs solving. So how do we move from we know there's a problem to solving it? That's what I would call the translational policy valley of death, for which this book may be the first installment or second edition of the first installment of that translational paradigm. That said, there is no single discipline, no single approach, epistemic, moral, political, conceptual, qualitative that occupies the singular moral high ground in how to move from bench to bedside or lab to legislature. Let me close now with my fourth and final observation, which is the only one where I want to use a case example. And it's the example of how climate or the environment and health are probably as good a case study in what this book is both about and how it is making a contribution to both curricular development and policy goals. I give credit for this final observation to selecting, not so much at random, but picking up David Resnick's chapter, which happens to be chapter 20 in the book, for a couple of reasons, which summarizes some of the history of what I might call the checkered, picks up some of what I would call the checkered history of the relationship between bioethics and climate or environmental ethics. We didn't used to talk to each other. In fact, we never talked to each other in the early days. David quotes quite rightly a famous set of papers by Van Rensselaer-Potter, a chemist actually, who wrote about bioethics and offered what was really one of the first definitions of the field back in those days, the late 60s, early 70s. But what Resnick referred to and Potter was talking about at that time was that the bio of bioethics referred to the biosphere, not a shorthand for biomedical. Bioethics these days has sort of been captured by biomedicine and has expanded to include other disciplines and subdisciplines. But what Potter was doing intentionally or otherwise, and Resnick picks up, was to recognize the interconnectedness of the role that the planet plays, borrowing from Lewis Thomas's Lives of the Cell, in fact, to make his case. So I was attracted to David's paper because in some ways he was opening that door again to an old conversation that got started but never really went anywhere as environmental ethics took its own path far away from health and focused mostly on, if I could say slightly humorously, plants and trees. What we've learned, sadly, far too late, is the interconnectedness between climate and health. And it is probably taking the approaching climate disaster to force a rapprochement of sorts. And if you'll forgive me, I will close my remarks with just a couple of sub-observations using the shameless self-promotion of a couple of reports from the CCA where I work. We released 2 reports in 2019. One of them was called When Antibiotics Fail, the expert panel on potential socioeconomic impacts of antimicrobial resistance. All of our work is online and you can find it for free. It's in both English and French. There were 3 bullet points that were the findings from that paper. The first was that in 2018, approximately 26% of infections were resistant to the drugs generally used to treat them, causing about 5,400 deaths in Canada at a cost to the Canadian healthcare system of about $1.4 billion per year and a reduction in GDP of about $2 billion per year. By 2050, without substantial attention, the rate of resistance will grow to about 40%, leading to about 13,700 deaths at a cost of about $7.6 billion per year, with the cumulative socioeconomic impact of the gradual increase in AMR from 26 to 40%, equaling about 400,000 lives, $120 billion in hospital costs, and about $388 billion in GDP. Lots of data, lots of evidence. What's the point? The point is that the connectedness between AMR as an event and the viruses and bugs that exist in the environment are so closely connected, principally among animals, never mind humans, that the failure to appreciate the connection between health and environment is done at our peril. You can use that overwrought phrase existential threat to any number of things, but I do think it applies to climate, just as I think it applies to our economic and health environments, and AMR is highlighting it. The second report was Canada's top climate risks, the expert panel on climate change risks and adaptation potential. The CCA panel identified 12 major areas of climate change risk facing Canada from a national perspective, all of which could involve significant losses, damage, or disruption over the next 20 years. In the panel's judgment, human health and wellness was one of the top 6 of those 12 of climate change risk. The others were physical infrastructure, coastal communities, northern communities, including indigenous communities, ecosystems, and fisheries. What's the point? The risk to human health and wellness from climate change stem from multiple climate drivers. I'm quoting here. They include injuries and loss of life from extreme weather, adverse impacts from lower ambient air quality due to wildfires, increased incidence of infectious disease spread through water systems, increased ranges of some vector-borne pathogens, adverse effects on food security, extensions of seasonal allergy periods, and short and long-term impacts on mental health and well-being. And by the way, it can also undermine human rights, including the rights to life, food, water, sanitation, and health. You might find it odd that I close these observations with evidence about the risks from climate change to Canada, an affluent country in the global north that has a healthcare system that, while challenged, is still available and able to respond to pandemics and other areas of health inequity. And yet, even in Canada, we are finding our medical system and our healthcare system challenged, facing resilience issues on a daily basis, with unequal access to care in some areas. We find this in Canada, we find it in Cameroon, we find it across the planet. There is no better case example than this particular book for how to examine, identify, and understand the global health ethical challenges that we're facing. We cannot pretend that they are affecting someone else. They are affecting all of us. Thank you very much for the chance to speak with you this morning, and I welcome comments and of course the panel discussion that follows. Thanks very much.
Thank you so much, Eric, for a wonderful address. And it actually, your panoptic view of the text, notwithstanding just taking a cafeteria approach, is really, I think, sort of underline why this text is important. And I can't wait to get my hands on it so I can dive into it as well. At this time, I'd like to introduce my colleague, Professor Erica Di Ruggiero, who's the director of the Center for Global Health, who will introduce the panelists and moderate our Q&A session. Over to you, Erica.
Thanks so much, Jennifer, and my thanks to Eric for a very thought-provoking presentation, and look forward to the panel. I'm going to introduce our three panelists. They'll each have about 10 minutes. I also just want to prompt the audience to get their questions in, because we will save a fair bit of time for questions at the end. So I'll introduce our three esteemed panelists who are also contributors to this book. Dr. Ross Upshur, who is the current Dalla Lana Chair in Clinical Public Health and the head of the Division of Clinical Public Health at our school, but he's also the scientific director at the Bridgepoint Collaboratory for Research and Innovation and the associate director of the Lunenfeld-Tannenbaum Research Institute, Sinai Health. In 2015, he was named one of the top 20 pioneers in family medicine research in Canada by the College of Family Physicians of Canada, and also previously held a Tier 2 Canada Research Chair for 10 years between 2005 and 2015. He'll offer some remarks, and he'll be followed up by Dr. Angela Mashford-Pringle, who's an Algonquin from Temiskaming First Nation, and also an assistant professor and associate director of the Wakibanis Bryce Institute for Indigenous Health at the Dalla School of Public Health. Her work for over a decade at the federal government involved Indigenous initiatives. She's also the director of the Masters of Public Health, which is actually a recent addition to our programs in Indigenous health programming. Also the director of the Collaborative Specialization in Indigenous Health, and the founding editor of the Turtle Island Journal on Indigenous Health. As the only Canadian and first Indigenous board member at the Community Campus Partnerships for Health, she's been finding ways to connect Canadian community organizations to university researchers in Canada. And last but not least, Professor Isabella Bakker is a distinguished research professor in the Department of Politics at York University. Her research examines the interplay between feminist perspectives and international public policy with a focus on macroeconomics and fiscal policy and how those affect questions of gender equity, social and intersectional justice. She's held visiting professorships at a number of institutions, including the European University Institute, New York University, and the University of California, Santa Barbara, and has also held several consultancies with the United Nations, the Commonwealth Secretariat, the Canadian government, and a number of advocacy groups dedicated to advancing economic and social justice. So as you can tell by these three abbreviated bios of these fabulous individuals, we're in very good hands. So I'll turn things over to Ross first, followed by Angela, and then Isabella. Look forward to your remarks.
Thank you, Erica. It's a real honor and privilege to be here today. And I'm going to keep my comments very brief. One thing about a year-long pandemic is you've spent a long time with your own thoughts, and I'm very keen to hear what Angela and Issa have to say. So first, thank you to Erica and Jennifer for organizing this and giving us the opportunity to celebrate this book, and to congratulate Solly and Gillian for a second edition. I mean, it's hard enough to herd academic cats once to get one volume out, but to have the energy and the willingness to do it again on an expanded volume is commendable. And I'm just thrilled and delighted for you, Solly and Gillian. And also to thank Eric for your exceptional and insightful analysis, drawing together a very complex volume and putting it into such a frame. Now, ironically, we have known each other a long time, Eric, and it's a weird synchronicity. When I was thinking about today, I put a topic of observations down and then proceeded to list several observations similar to you, but I'm going to be brief about it. So the first observation, and it picks up on Jen's beautiful opening and Eric's comments, this is a timely and much needed book. The new volume has expanded chapters covering almost all of the important issues relating to global health, and now we're starting to talk about planetary health as we start to engage with issues around climate change and climate justice and many other things. The other thing to comment on the book is the high quality of the chapters. 64 authors of first-rate minds, some of the best in the world, reflecting on struggling with and engaging with highly complex issues. And so when you read the book, you will be enlightened. So my second observation is, well, what does this book achieve? And I think Eric touched on a lot of the points that I wanted to make. If you want to start to ask questions of where we are now as a species inhabiting a rock that hurtles around a sun that has finite resources, that's got its own fragility and delicacy, if you want to have some way of thinking about this, about how we got there, this book provides both a descriptive account of the forces and drivers of our current fate and an explanatory and analytic language to help make sense of this. But most importantly, I think is it's nudging towards the normative analysis. Where are we? What should we do? How should we achieve it? What are our obligations? How do we work collectively to solve some of these pressing issues? What I really like about the new edition is that it's expanded the voices. There's kind of a will towards hermeneutic justice here by expanding the voices and the roles of different disciplines, different traditions, different cultures, so that we can collectively think together to move forward. So how should this book be used? So every author who writes a book wants it to be read. And I do hope it gets a broad and deep readership. And I think, Eric, you've nicely pointed out that you can take it buffet style. You can dip in here, you can go a little bit more in depth here. I would advise you keep it by your bedside for the next year and to dip into it frequently. But I think really what it should be used and how it should be used and how I would hope it would be used is as a resource for education within our own environment at the Dalla School of Public Health. I'm just going to speak somewhat grumpily as an academic who's contributed to many edited volumes that have served as partial textbooks. We've brought lots of great people together to produce a resource, and yet in our own home, it never gets used for the teaching of our students. So I really hope, my most fervent hope for this book is that it becomes alive within our school community, that our students and our faculty read it, that it stimulates discussions locally. Of course, I want it to have a broad impact in other jurisdictions, but playing the home card, I would really like to see it brought to life, come to life, serve as a focus for discussions amongst faculty and students as we struggle with this, as we transform our curriculum, as we come out of COVID and start to think about what lays before us. So timely and needed, vitally important ways of thinking, And I hope it's used wisely and widely. Thank you, Solly, for bringing it to us, and thank you all for allowing me to speak today. Thank you. Over.
Thank you. Thanks for that helpful reminder that we need to model this starting at home. And just as by way of a commentary on that, Ross and I will be offering a course on planetary health, global health ethics, along with many contributors, including Solly Benatar, which will do just that. It will build on the chapters in this book. So, Angela, can I turn things over to you?
Yes, Ani, Kwekwe. I hope everybody's having a good day today. I took a different approach, but first I want to thank Sully and Gillian. This was a huge undertaking. I want to say it that way because I don't know how you got us all to be on time and to get everything in, because that's not easy. Academics are always fighting against clocks, these imaginary clocks that we can't quite get through. So this is great. And I've thumbnailed through the different topics as we were going along and as we move forward. I think the thing that I really wanted to talk about is about the chapter that I wrote with Mark Hathaway and Blake Poland. And as an Indigenous scholar, the one thing that's yelling to me, if you will, is that we talk about planetary health, we talk about Indigenous people's health, but we don't talk about them necessarily in the same sphere. So for the first time that I had the opportunity, we did that in this chapter. So we talked about this whole idea of ecocide, the idea of destroying our planet and how that's going to destroy us. And we know it's happening. It's not hidden. It's not something that we aren't aware of. And I work with knowledge keeper Clayton Shirt at Walk Up and S, and his big thing is if humans disappeared tomorrow, the planet would regenerate. It would all come back to life. But if everything, even just portions of everything in our world disappeared, we would die with it because we rely on everything on this planet to live. The animals, the insects, the water, the air, the trees, the plants, the fish, the birds, you name it, we can't survive without it. And so one of the things that I think in writing our chapter and the work that I do is reminding people that we have to be more in connection to land. So Jennifer did a wonderful land acknowledgement today, but I want you to think about how are you connected to the land that you're standing on, sitting on, being on? And what does that mean to you? And what have you done to help Mother Earth come back from the destruction that we've put on her? And in all fairness, we're destroying her in many, 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 many ways. The idea of our buildings, they take a huge carbon footprint in order to create bricks, to transport those bricks and other building materials to a site to build. That has a huge impact. I'm not saying we don't want buildings. I'm saying we have to start thinking about what that does to our environment and how that affects us as people. This destructive architecture that we have going on, where we're in the middle of a pandemic. People who are homeless or experiencing homelessness are being put aside. People are getting fined for trying to create little tiny homes for them and putting them on city property. And the destructive architecture that we have makes it so that there's no place for them to lay down. Think of park benches, think of the places that we have open and available that none of us are using at the moment. In the wintertime, I don't see too many people walking through Trinity Bellwoods or Christie Pitts. They may be at Christie Pitts just so they can go tobogganing, but there's still more land there that we could be using. And I don't mean this in a permanent built structure, but the fact that we could be housing people. And, not in my backyard, we have to stop thinking like that because everything is our backyard. And we've got to start thinking more collectively, which is part of what we were talking about in our chapter. We started talking about Indigenous ways of knowing in that chapter. We didn't want to inundate people with it, but we don't have clean drinking water or clean potable water, let alone some of the other issues that are going on in some of our First Nations, overcrowding housing, inadequate housing, the ideas that we're not taking care of the planet. And if we don't take care of Mother Earth, then we won't survive either. So we have to start thinking about how we're going to take care of everything on this planet. So, since this chapter, I've started to write a lot about giving personhood rights to the plants, to the animals, to the trees. When was the last time you went out and touched a tree or talked to a tree? Yeah, I know I'm the crazy professor who says you need to go talk to nature, but it also helps your mental health and emotional health. And if you go out and do these things, I think it's really important. It helps. We all know the science is behind it that if you talk to a plant, it grows. So if you go out and talk to the trees, they'll grow. They talk to each other underground, but we also have a bad habit in cities to plant them in planters where their roots can't grow and touch each other, so they can't grow into a community. We need to be that community. We need to grow together. We need to start talking about social justice in terms of the environment and planetary health, because if the planet's not healthy, we can't be healthy. And I'm watching in other work that I do where we've destroyed the planet and said we want cash crops. And we've taken over those spaces where we would have grown traditional foods like wild rice or other vegetables and other fruits. Or we've taken over spaces where we know that animals would have roamed before. So, watching over the winter, I watched a lot of videos where they were talking about the bison coming back to the plains. This is huge and something we absolutely need to see. They are part of the food chain. Every time you say you don't want that nasty wasp or you don't want that, ant, think about that's a food source for somebody else in that food chain who then becomes something of our food sources. So we have to start thinking that way. And the relationships that we have should be reciprocal. We can't keep thinking of ourselves as human beings at the top of a pyramid and everything for our purposes, like that we can destroy it or over reap it. We have to start thinking about it in terms of they are our equals. They are our brothers, our sisters, our aunties, our uncles, our cousins, our ancestors. And so I know when we wrote this chapter, we talked a little bit about that. I do think that there's something to be said about living well and celebrating the beauty and the diversity and the relationships and the reciprocity that we have, and how can we help regenerate our planet. That's not through pipelines, that's not through tar sands, that's not through fossil fuels. And I know I sound like a somebody trying to convince you not to have pipelines. There are other ways. We have them. There's ancestral knowledge in all of us. We just forgotten. We need to wake up today and try to figure out how we're going to work with our ancestors. So I'll leave it there. Thank you.
Thanks so much, Angela, for reminding us about the importance of connecting to the land, and also knowledges that are historical but are being lost if we don't reconnect with them in contemporary times. I'll turn to our last panelist, Isa.
Thank you. First, thanks, Solly and Gillian, for inviting my co-authors, Stephen Gill, Dylan Walmsley, and I to be part of this important and urgent project. I think that one of the great strengths of this book is that it underscores that ethical principles are meaningless without material underpinnings and provisions. Inviting feminist political economy perspectives into the dialogue opens up the discussion of absences and silences in mainstream discussions. The production and maintenance of labor power, the care for children and the elderly and others, and the production of goods and services necessary for the maintenance of human life are all encompassed by what feminists call the sphere of social reproduction. This sphere underpins the paid economy and global health. Many have pointed out that the coronavirus pandemic is a crisis of social reproduction, highlighting the importance of the activities performed by those in this domain and the severe shortcomings of the capitalist political economy when it comes to ensuring human well-being. This understanding of the contradictions between the necessary conditions of social reproduction and neoliberal capitalist development also informs several of the contributions to this very important volume. The twin concepts of market civilization and its organic crisis, for instance, help frame a critical perspective on the global political economy. Market civilization describes the extractive economic model based on highly unequal and carbon-intensive growth and the 24/7 consumption of the affluent at the expense of the rest. By global organic crisis, I mean one that's simultaneously an economic crisis, a social crisis, and a crisis in the relationship between human beings, their forms of livelihood, and nature. So what I'm really trying to say is it's simultaneously an ecological and a political crisis. The deep crisis of global capitalism that Eric referred to from 2007 and 2008, followed by a decade of virtual non-recovery and austerity, now is compounded by COVID. And this has undermined some of the basic conditions of existence for the majority of the world's population, posing threats to the health of the global population as a whole. The twin pandemics of climate change and COVID-19 can be linked to market civilization and its 24/7 consumption model in the rich countries, which is driving climate change and connected to healthcare systems geared to the affluent at the expense of the whole global population. A further morbid symptom of organic crisis and market civilization is the increased inequality throughout the globe. The pandemic is likely the first time in history that inequality rose in virtually every country on Earth at the same time. According to Oxfam's recent report, The Inequality Virus, it took just 9 months for the top 1,000 billionaires to return to their pre-pandemic highs. But for the world's poorest people, recovery could take 14 times longer, estimated to be more than a decade. The pandemic has exacerbated inequalities, but these existed well before, in a world where nearly half of humanity was forced to scrape by on less than $5.50 per day. A world where for 40 years, the richest 1% have earned more than double the income of the bottom half of the global population. As Oxfam notes, this inequality is the product of a flawed and exploitative economic system, which has its roots in neoliberal economics and the capture of politics by elites. This flawed economic model has exploited entrenched systems of inequality and oppression, such as patriarchy and structural racism. The current crisis has made visible what I've called the strategic silence, the whole realm of work and care that's unpaid, yet necessary for people's daily survival, their health and well-being, and for markets and the quantity and quality of labor power they so rely upon. We know that globally, women provide the majority of this social reproduction labor. Prior to COVID, on an average day, women globally spent about 3 times as many hours on unpaid domestic work and care work as men. Amid COVID-19, household chores and other domestic work, homeschooling, and work from home arrangements have gained new attention and value and are being recognized as essential work. The UN reports that since the pandemic began, women are spending 30+ hours per week solely on childcare, almost the equivalent of a full-time job. Those working in the informal economy, some 740 million women worldwide, have a long history of the home as a site of work and care. Finally, globally, women make up 70% of the health and social care workforce. And while these jobs are essential for a pandemic response, we do know that they're also undervalued and poorly paid. The increased demands of unpaid care and domestic work have been recognized by very few governments, according to the UN, which reports a mere 8% of all existing social and labor market measures focused on this domain. This suggests the need for a new common sense, an epistemological break from flawed concepts of progress that is also a part of the message of this book. Global health problems are fundamentally social, and the fruits of health research and provisioning should be global public goods. Yet we've seen the gap between scientific success with vaccine development through global cooperation and political failure and nationalist responses. For a new common sense to develop, we'll need a new paradigm of global political economy, one that's based on a new conception concerning the nature and potentials of the world that can address global health challenges in a progressive way, and one that connects to the fundamental bases of social reproduction and human security as people face them in their everyday lives. Thanks very much for listening.
Thank you so much for providing that perspective on how many of these crises are also gendered and what is valued by society and undervalued, yet how critical it has been to the response to COVID and many other past crises. Before we open up the floor for questions from the audience, and I see you're being a bit silent, audience, so this is your cue again to submit your questions. And I first want to just acknowledge that all of the wonderful congratulatory notes to everyone, to all the authors and panelists, and to Solly and Gillian. So thank you for those kind remarks. I would like our panelists to maybe take an opportunity to react to anything each of you have said that you might want to pick up on. So Eric, I know you were sort of first to speak, and then you had a chance to hear the discussants pick up on some of your comments or reflect on other things. I'd like to give you the first chance to perhaps reflect on anything you would like to elaborate on or comment on.
Sure, thanks very much, Erica. And you know, it's easy to keep congratulating and thanking everybody, but I thought that the three panel presentations, it's as if they were planned to a T, both in their order and in their content, because I thought they fit together beautifully. I'm not going to go through each individual one, but anyone who was listening but didn't hear what was said, they should play the YouTube video again so that they can get the richness. I just want to flag a couple of points that I think the highest compliment is, I wish I had said them, because that's what I was thinking, but I never said them as well as they had been said. So when Angela was speaking about the land, I think she captured far better than I could have in my sort of stumbling way to explain that these are not categories of discussion anymore, that it's all of the above. And, you know, I read The Secret Life of Trees and loved it and felt immediately what Angela was referring to when we talk about planting trees in pots, and there's so much to the idea of how our built environment and the not yet built environment, which would be the cynical version of the dichotomy, is and will forever have an exponentially dangerous impact on the life of the people who live on the planet. And probably, I might push back a little bit, I suspect if humans left, something else would probably not survive as well. I don't know what those things are, but I love the example from the Knowledge Keeper. So the main point that I think the comments from Angela reflected for me was that almost revisiting Potter's old argument. I mean, it was a charming, almost naive argument in 1971 when he proposed it. You know, think about the bridge to the future is a bridge to, you know, a planet that's healthy. What does that actually mean? Well, I think we now have a better idea, evidentially and ethically, what a better planet looks like. My worry, having also just read Bill Gates's recent book, How to Avoid a Climate Disaster. I'm not plugging his book here. I'm just mentioning that I read it. Surprisingly, has a few of those themes in it too, and in an interesting way, this gets to Isabel's point. This is not just the research community's job. This isn't even the elected politicians' job. This is, what are we all going to do? Like, each of us. And I think that challenge is one of the most exciting and frightening challenges that we face. And I'll just leave this on a dramatic, provocative point. Failing to do so is not allowed. Failing to do something is not allowed, because not doing something is actually doing something. Now, the list of what you can do is pretty long, but we don't have that option anymore. Like, that's off the table. Too big a problem, don't know what to do. Angela gave a Reader's Digest, tutorial on what some of those things are, beginning with, now's the time to start thinking about it deeply. We can all do that. I'll leave my remark there. Thanks.
Well, I guess maybe it's part of reimagining public policy, because for policy pundits in the room, doing nothing is always a policy option. And I think we've been doing nothing far too long, and we need to disrupt systems and use these three crises, as Isabella carefully pointed out, the climate crisis, COVID-19, and health inequities as the game changers for action. Are there other comments from Ross or Angela or Isa about what you heard from each other? Otherwise, I'll go to the questions from the audience.
So yes, I was trying to be a little provocative. I do want to make note that, if our planet was healthy, we may not have been in this pandemic. Diseases lie in our soil. So they're noticing in the Northwest Territories now, because the permafrost isn't staying all the time, that they're finding anthrax. So, if the planet's not healthy, we're not going to be healthy. And, I talked about personhood rights, and I want to just mention that last month, Quebec has actually given the Magpie River personhood rights. What does that mean? It means you can't just go in there and abuse the river, meaning you don't put logs down it, you don't throw garbage in it. And this is what I'm kind of getting at is, and Erica said it, this idea that we have to start thinking differently. And my co-author Blake Poland and I, when we did this, we had just come off of doing a project called Many Lenses, and we were talking to people about how do you reimagine everything? Like, I'm not saying that I have the answer, because I certainly do not have that answer, but can we continue to have, as Issa had talked about, this whole neoliberal capitalism go on forever and ever? And I think that that's something that we also have to start thinking about. Made vulnerable populations like Indigenous people are made vulnerable. They did not put themselves in this position. It is our society that put them there. And you've taken away the resources they would have used to survive. And so I feel that it's something that we as a global communities need to start looking at and addressing. We can't keep putting hydro lines in the middle of a lake. It gets rid of the fish. There's lots of evidence, whether you want anecdotal or real. We can't keep saying we're going to build another high rise and think it doesn't have an impact on the birds. If it has an impact on the birds, then you have all their predators who can't eat. And that chain keeps going and going, and we end up, where we are today, and it's getting worse.
Thanks. So I'm going to maybe shift gears and turn to questions from the audience. So Eric, one of the participants wanted to pick up on your point about the golden rule. So does any chapter examine the role of conflicting interests in just policy, recognizing planetary history of colonial exploitation, entrenched discrimination and control? So That could be a comment for either you, Eric, or maybe Solly might want to weigh in as well.
I'm going to let Solly do any kind of granular answer, but I think it's a great question, if I could not so much reframe it, but maybe interpolate it. I think embedded in several chapters, including a few that I had alluded to, that sort of get to, and this is sort of section 3, if you have your table of contents in front of you, it's a section called Analyzing Some Reasons for Poor Health and Responsibilities to Address Them. And there are, I think, of almost 10 chapters in that section. I didn't read every single one of them. I alluded to a couple, but they talk about debt restructuring and arms trade, the amount of money that is being spent in the military, trade and health, and several others. Ross may wish to speak to this because his paper with Solly and Stephen Gill are in that same section. So I think the broader question of how and what role, to be really vulgar about it, money plays in the priority setting of how to solve problems and how to deploy those funds in order to solve them is an example. I called it the golden rule because it's just a kind of cartoonish version that is borrowed from some other conversations regarding if someone has a big grant, then what that does is it often crowds out others in the field. So there's a phenomenon that happened very early in the Gates-Buffett debate. It was actually called the Gates-Buffett effect, where if Bill Gates and Warren Buffett are spending a lot of money on HIV, TB, and malaria, then maybe others of us, whoever others of us might be, don't need to spend money on that problem because those guys have covered it. That's a very worrisome conclusion. I'm not saying that I drew it or that others would, but the power of finance to be deployed as an instrument of public health or global health action is underappreciated, I think, in many ways. So I would just say that section, in my view, Solly may join in now or later and refer to others, but there's nothing in this book that you can't take two breadcrumbs or two dots to connect to issues of how the organization of society has a direct impact on the health of society.
Solly, did you want to weigh in at all or wait?
Yes, now I'd be happy to do so. I think this is a crucial issue. For me, the global political economy lies at the heart of the problem. Energy consumption, how we consume energy, is the cause of all the problems we are seeing. And there's been an exponential increase in the use of energy due to the industrial developments and the scientific advances that we've made that have allowed us to consume an enormous amount of energy. The problem is that a lot of that consumption is frivolous. It's consumption that doesn't really serve any useful purpose. We're wasting resources. We're consuming the planet not to produce good, but to produce harm. And unfortunately, that's the elephant in the room. That's what nobody wants to address. Nobody wants to address the fact that the whole global political economy is fraudulent. John Kenneth Galbraith described it in his book as the economics of innocent fraud. Innocent fraud because many people operating within the economic system are good people trying to do good work, but who are following in tracks that are laid by others that lead to the issues that we're facing today. And more than that, there's a denial that these issues are important. We're not willing to face up to them. So if we can't face up to the basic root causes of the problems that are leading to destruction of the planet, we're not going to be able to resolve it. So I turn always to a medical diagnosis and to Kubler-Ross's ideas of when you make a fatal diagnosis. We're facing a fatal diagnosis of the planet. The planet is in entropy. It is a dying planet. If we can't admit that, if we can't understand that that's what we're living with, and if we don't then begin to look at what the root causes are and try to address those, understand the pathophysiology and see whether we can address those issues, well, then all we're going to be doing is counting more numbers, more calculations, more data, more hypotheses, more unwillingness to face what the problem really is. And that is our problem. So for me, the challenge of this book is to encourage very deep introspection and reflection and an intensive educational effort at trying to understand what it is that our lives are about. What is the meaning of our lives, and what are we doing to this planet? Can we, through that, develop a global and planetary perspective? And for me, the word global, ever since the first edition and earlier, has always meant planetary. It hasn't just meant international or across the globe. It's meant the globe as a biosphere. I take Van Rensselaer as someone who I've admired for many years. What we need to be doing is to cooperate at many levels, and this comes back to Angela and my interest in the lack of a dialogue between people of different cultures and different value systems. We're not examining our belief systems in a way that enables us to traverse the profound barriers that are required for us to communicate with each other in a meaningful way. That's something that's been enormously neglected. The next thing we need to do is we need to reset our entitlements and our expectations. When I was listening yesterday to the faculty meeting at the Dalla School of what the students were expecting from the faculty and from the school, I thought to myself, you know, these are amongst the most privileged people in the world, and yet their entitlements are endless. It's an endless stream of entitlements that people feel. We can't keep thinking that it can be more of everything. A motto for the future has to be, how do we do better with less? So I see this book as a starting point, as a catalyst towards trying to think in new directions and think into the future in an interconnected planetary way. And what I would hope somehow is that some memes would arise, the sort of memes that Richard Dawkins mentioned, which would spread through the brains of people throughout the world and get them to realize what the problem really is and how we might be able to deal with it. Because it's that mass belief in the idea of what we're doing is wrong that would be helpful. It's not going to come from above, and it's not going to come from anybody legislating for it in a particular way. It's a mass consciousness that's required of us to change our own directions. And I would hope that this book would just serve as a catalyst. It's the first step, as you mentioned, Eric. It doesn't solve all the answers, but I think it points in the right direction. And my hope is that it will take off in that way.
Thanks for.
I want to make one final point, if I may. Sure. I started off on this path over 40 years ago, living in South Africa and seeing the disparities in our country attributable to what was called at that time apartheid. But you know, what we are seeing today is global apartheid. Apartheid is a phenomenon throughout the world. It may not be legislated for in the law books like it was in South Africa, but that's what it is. It's apartheid. And the gaps are widening. And we're not unifying in any kind of way. Now we have to recognize that that's the problem. We almost need a Truth and Reconciliation Commission to understand where we've gone wrong and how we can move more positively into the future. And I think that there are many clues to that throughout the book. And I thank you all for pointing that out. And I do want to conclude by saying that I would not have been able to move in this direction without the support I've had from my colleagues at the Dalla School, who've had me over every year for 20 years and given me the opportunity to interact with all of you and with many of the authors in the book. And the pleasure and the privilege of working with Gillian, who's been an outstanding and superb co-editor. We've worked absolutely seamlessly, despite being millions of miles apart and unable to actually meet with each other in any way. It's been a wonderful cooperative endeavor. And it's that kind of cooperation rather than competition that I think must surely characterize the future if we're going to make progress.
Well, I think on that note, I'm going to bring this fantastic book launch to close. Let's consider this a new beginning and beyond a reset at the expense of starting to use all of the rewords that Eric alluded to. I think we need to move beyond the rhetoric, I would argue, and embrace the many wonderful ideas that are in this book and really use it as an agenda to transform meaningful action at the global level, and to build bridges within academia, but also across different groups of society and to take a whole of government approach. So on behalf of all of you, let me just take this opportunity to thank Eric for delivering such a beautiful keynote address to get us thinking, to our three panelists, Ross, Angela, and Issa, to Solly and Gillian for bringing all the authors together, and last but not least, Jennifer for co-hosting this event. And I also want to thank Lori and Vadim, who behind the scenes have really helped to make this event possible. So thanks to all of you for joining. Please buy the book, and look forward to further conversations with many of you about the contents of the book. Be well.
Thank you all very much.